Hello, everyone. Welcome to today's discussion. This is Q&A with the CNO Nursing Edition. My name is Jenna Pope-Martinez, and I work in marketing at Tallahassee Memorial HealthCare. I'm going to be your host today. I'm going to help kind of facilitate some of the questions, getting to our guest and resident nursing expert. Any career decision requires a lot of thought and a lot of information. I had a lot of questions whenever I entered my career field, and I often wish that there was a safe space where I could just kind of ask someone everything that I wanted to know. I'm just going to go ahead and tell you there are no stupid questions, no dumb questions. We want to answer everything that you have concerns or questions about. Whether you're graduating from nursing school or you're just starting to think about applying to maybe nursing school, our hope for today's discussion is to provide you with all the answers that you need and have you feeling a little bit more confident about your career decision in nursing. Thankfully, TMH has a lot of opportunities for you if you're just kind of thinking about nursing as a pre-nursing student, a nursing student, and as a new nurse. And we are in luck today with the guest that we have, the person who will be fielding these questions. Please welcome Ryan Smith. Ryan Smith is the Vice President, the Chief Clinical Officer, the Chief Nursing Officer at Tallahassee Memorial HealthCare. He holds a master's in nursing, a master's in health administration, and is a registered nurse with over 15 years of experience. We're going to talk a little bit about your background, Ryan, if that's okay, while we kind of get some questions rolling into the chat. Do you want to explain your role as Chief Nursing Officer to those who might not be in the nursing profession, your career path, and some of the career opportunities at TMH?
Absolutely. Thank you, Jenna. And thank you for joining today. Hoping that this is exciting for you all. I appreciate the opportunity to just provide information. And, I was sitting in your shoes as a nursing student and looking at my career path back in 2008. I graduated from Columbus State University from Columbus, Georgia. A little bit about my personal history. I came from a military background. To me, I thought it was the best thing ever, where I had the opportunity to see the world, see the United States. Divorced family where my father was in the military. My mother was in healthcare, stayed in Columbus, Georgia. Opportunity to go to school in Columbus, Georgia, but really saw the world. And graduating from Columbus State University, I had to make a tough decision to say, where do I want to go? Where do I want to start my career? And was fortunate enough to get that opportunity here at Tallahassee Memorial HealthCare. And as we go through this, I'll just provide some context around why my decision was for Tallahassee and the benefits of Tallahassee Memorial, but hopefully as we go through this as well, it provides some clarity to you all, whether you're in nursing school or pre-nursing. Hope to answer a lot of questions about TMH, the field of nursing in general. Went into as a new graduate. So I'm actually one of the new graduates here at Tallahassee Memorial. Started my career here at TMH. Wanted to do a leadership track, progress through leadership. My philosophy in leadership is love nursing and the bedside aspect of nursing, love making a difference in the patients and the families' lives that we serve. But the bigger calling to me was in a leadership role, you have the opportunity and the availability to impact multiple lives. And I had the opportunity to serve others. And that's really been my motivation into leadership, put one foot in front of the other. Let's take and serve and take care of our colleagues and take care of our patients. And as you can see on the screen, had a pretty rapid track into a leadership development and role here. Current capacity, clinical chief nursing officer / clinical officer in general. Is a hybrid type role where it's not just nursing. It's over all of the allied divisions as well, radiology, respiratory, laboratory, pharmacy. So great opportunity here to really work on the clinical integration of all the aspects that we care for here. Been in my role since 2019. As you can see here, and one thing that is great about Tallahassee Memorial is the development opportunities that you can see the progression through my career, and really have found TMH as my home for multiple reasons. So started as a new grad, as I mentioned, back in 2008 in the Bixler Emergency Center. My draw to TMH was I wanted to work in a large academic health center that saw complex patients and just applied to multiple areas outside of Columbus, and was provided the opportunity back in 2008 to start my career at TMH. It's been the best decision of my life. Went back to obtained my master's degrees back in 2016. But that's a little bit of history about myself. What drove me, and I know this is one of the questions that's coming forward, into the nursing clinical profession. I come from a background of healthcare professionals. My father is a PA, my mother is a radiology, my stepfather's EMS, and I knew that healthcare was for me. I wanted to be that, to offer that service and impact lives. My father actually talked me into becoming nursing. I had a draw to go to PA school, and he said, Ryan, go into nursing school. You have the diversity, you have many, many opportunities. You could launch into leadership, you could do advanced practice, you could be a bedside nurse. There are many, many opportunities in nursing that you don't see in other healthcare professions. And that was really my draw. And it's been the best decision that I've made professionally in my career. Next slide. I also want to highlight, and this is just a small, small segment of individuals here, that all these individuals, and one thing that's unique about TMH is we really believe in professional advancement and growth. Our leaders here have walked the trenches, have walked as the bedside nurses, have grown into the leadership, where I think that is unique compared to other institutions. That is different. And these are just a small number. We have many, many more individuals, but all of these individuals have grown up as bedside nurses, have started their careers here as new graduates that are now in leadership roles as directors and above, that in the same position that I am. And I think that is one of the unique things that we offer at TMH that just is not seen in many other places based off of who we are. A little bit about TMH, and this is really the draw to me. And as you go through looking at your career and you're selecting your place of employment, it's important to note, where do you want to go? What is important to you? Vision and mission to me was extremely important. And a little bit about TMH that's unique to other places. We were founded in 1948. We're a private, not-for-profit community healthcare system. We are here to take care of our community. And that is important. Our governance is local. We have local board of governors here. We have the autonomy that if we see needs in our community, we can make changes that many other places cannot. We're not corporate. We don't have the same red tape, I would say, that other places have, that we have the flexibility to really provide the community healthcare that we need. And if there's ideas, if there's needs, if there's services that we want to offer, TMH provides that autonomy that many other places cannot. The complexity at TMH is tremendous. And I know a lot of nursing students that attend their clinicals here, is when you take a step back and you look at other metropolitan cities, we do many of those specialties that other places do. The only thing that we don't do here is transplants and burns. The complexity here is tremendous. If you could work in this environment here, the experience that you'll gain here, you could then take that to any other place in America, in any other healthcare system in America. This TMH prepares you for that. We have comprehensive trauma. We actually see the highest trauma volume in the state. When you look at our regions here, that we go from Pensacola to Jacksonville, down to Gainesville, up to Macon. We cover a large area that metropolitan cities don't cover. We have comprehensive stroke services that is really cutting edge technology, advanced cardiac programs here, cancer programs, orthopedic, that we have a wealth of established, incredible programs here that offer a lot of specialties to our patients and as well as our colleagues. A little bit of current state where we are today, and I'm going to mix this with state data as well. So when you look at turnover, we have seen an increase in turnover post-COVID. We're in a unique section right now of healthcare where there's a lot of changes with COVID. There's a lot of technology changes. There's a lot more advancement that we've seen today that we haven't seen historically. The culture is adjusting and adapting to post-COVID era. And what you've seen in the state is you've seen an increase in nursing turnover at 37%. The gold standard historically prior to this was 26 or 20%. That was the magnet standards of anything, in the range of 15 to 20% with the gold standard. Since COVID, post-COVID, the 2022 data for the Florida Hospital Association is a 37% turnover for the nursing bedside. We're at 26% here. Our goals internally are to be at 20%. So we have some opportunities to look at, but when you compare it across the state, we're performing better than the majority of the state. From the vacancy standpoint, we're very, very fortunate here at TMH. We have great community colleges that I'm sure many of you attend that really provide the opportunity to produce a large pipeline of students. I know there's been expansion of classes at TCC, at Florida State, at FAM, that is really can provide benefit for us long term to keep nursing students here locally. That being said, our vacancy rate's less than 7%. We have 1,600 bedside nurses at TMH. The state average right now for vacancy rate's 21%. So when you look at a comparison, we're doing significantly better in comparison to the state. The majority of our vacancies are in a concentrated area, which is medical surgical. And that's one of the things that we could talk about as we go through. Medical surgical provides that base to really launch into your career. But we're seeing a lot of new grads that want to go into advanced specialty areas. I understand it. I went into emergency services myself, but that is really a need that we have to fill in the medical surgical areas. But it really provides that expertise and that foundation that we need to launch. But that's really the majority of where our vacancies are today. My advice to you all, and this is what I have learned, the knowledge that I have now, the knowledge that when I was sitting in your shoes back in 2008, deciding where I'm going to go to start my career, these are the top 5 things that I think you need to review as you start looking at places of employment. What is the mission and vision of the organization? Is that important to you? Being a for-profit center, being a not-for-profit center, understanding the difference between the two, is that something that's important for you? For me, it is. To me, it's I want to serve our community. I want to be a not-for-profit system. I want to have a mission and vision that ties to the needs of our community. For all, there may be differences. To you, that may not be important. To me, that is important. I will tell you the governance, the structure, the operations. There's a difference between for-profit and not-for-profit. And to me, having a center that is not-for-profit was key to me. And I knew that when I started the application process, the places that I applied to were all not-for-profit. Medical staff expertise, tenure, and support. I cannot stress enough that as a nurse, the collaboration, the relationships that you have and we have with medical staff goes a long way. You want tenured medical staff that is there. You want highly credentialed and highly trained medical staff. You want them board certified in their area of expertise. If able, if possible, you want medical staff that is employed by the organization that has long tenure. One of the unique models here at TMH is starting my ER career, we have employed ER physicians that are board certified ER physicians, and the amount of time that they spent training me, providing that knowledge and that expertise, prepare me to be a great nurse. And I think that is a key distinction as you launch your career. Make sure the institution that you go to has a credible, good foundation of medical staff, because what you learn from them and what they learn from us is tremendous. Acuity, experience, and complexity. Every time I have the opportunity to speak to new graduate nurses or nurses that are going into the field, I'll always say, you want to be in an institution that is a large institution that provides you that experience, that has systems to support education and training that is highly complex. You want to start here before you go into a rural environment, because when you're in a rural environment, you're independent. And what you learn is by few cases, but you don't have the support around you that other places have. So in my opinion, having a system that is complex, that has high acuity, provides you the experience that you could then go here and be confident and be safe in other areas of practice across the nation. Nursing support and engagement. I'm gonna go back to what our core is for not-for-profit. We want our nurses to be empowered here. We want decision-making ability here. We want them to have a voice. We want to be highly engaged. We want leaders that are engaged. I cannot stress this enough, that you want to be in a place that you enjoy, that your value and your input and your voice makes a difference. This is important. The last thing, for a selection area, and I can say that I did not follow this or see the value of this when I was sitting in your shoes. I was gung-ho that I'm going to go to the emergency center, and that was my decision. Leadership is key, and we have great leaders here. There are many institutions that do have great leaders as well, but just as important as your area of specialty that you're going to, make sure that leadership fit and that culture, that unit fits what you're looking for as well. We have different vibes across different units, and that's okay. But nurses thrive in different areas and under different leadership. Make sure that when you have the opportunity to shadow, to meet the leader of the unit, make sure you understand that vibe and that culture of the unit, It's as equal it is that you want to go to this area of expertise, critical care, emergency services, women and children, whatever that may be. What is the leadership culture of that unit as well? And is that a good fit for you? Um, Cannot stress that leadership enough. When you have the opportunity to shadow and to meet those individuals, please do so, because that experience is equally as valuable as anything that you'll do.
Thanks, Ryan. I'm sure we have a lot more questions coming in after all of that information. That was all really great. I want to talk about the shadowing. Are there opportunities during the interview process to shadow, and even before the interview process, are there opportunities for students to be able to shadow before they come to TMH?
Absolutely. Highly stress that, if you're in the final stage of your application period, and you're interviewing on units, please ask for that shadowing experience to go upstairs to see it. Please explore multiple units before you make that selection. That is key. So yes, the opportunities are there. If you're going into pre-nursing, whether that's students, we have processes to credential students here to get exposure to, is nursing what I want to do, or is healthcare what I want to do? You look at opportunities such as that as, can you get jobs, or can we branch out to do patient care techs? Can we do unit secretaries? We have so many disciplines of jobs here that don't require a nursing degree, that you can get exposure to TMH, to healthcare, and then make that decision on what areas you want to go to specifically, what training you want to go to specifically. So the opportunities are there for both of those.
Are there any areas that you feel provide additional support, allow people to develop their nursing skills before they go into specialty units?
I'm a strong believer, and I've seen it. And now, being in a leadership track, I started in emergency services. It has been double the work for me to go back and learn the fundamentals of medical surgical, where medical surgical provides a foundation for everything. It provides the assessment skills, the time management skills. It really launches your career. I would tell you that if you're uncertain to where you want to go, medical surgical is a great area. If you have a very crisp career path, for instance, you want to be our CRNA, you want to do anesthesia, and that is your directive. We know that it requires a year of critical care experience. Start out in critical care, then branch over to the CRNA. If I could take things back, and if I could be in my leadership track that I know I'm in today, I would have started in medical surgical, because the amount of knowledge that I had to go back and relearn those fundamentals and foundation. If I started in medical surgical and I launched to emergency services, I'd then have a full picture. It's been double the work for me to go back and have to relearn that. So my advice is, if you're uncertain, if you don't know what your final career path is, start medical surgical, because it provides you the foundation that you need.
Excellent. We have a question from Ray, who asks, what is the ratio at the main emergency department?
So our emergency department, the Bixler Emergency, they have a pod system that they work upon, and it's really a teamwork model. In a traditional normal day in acuity, they're 1 to 3 is what they focus on. The emergency services Northeast is a little bit lower acuity when you look at just the complexity. They're 1 to 4. If patients that come in that are higher complexity, traumas, strokes, STEMIs, they have a 1 to 1, because that pod system that they have a charge nurse per pod. They have a shared relationship with the patients in the pod. It's a 1 to 3, but we also have the opportunity to provide flexibility to do that 1 to 1 when the care is needed.
Excellent. And then we have another question from Janine. I appreciate the transparency you provided about turnover rates and vacancies. You also emphasized the nurses having a voice in the hospital. Could you elaborate on how the hospital manages communication and feedback channels between nursing staff and leadership to maintain a transparent and open dialogue? You've had a busy day of that as well.
Yeah, absolutely. So we do many things here, and I will tell you, communication is always the key to success. There's always opportunities around communication. You have to communicate in multiple vehicles and avenues that we communicate. We had town halls today. That is a key piece. We've been doing town halls all day long. And thank you, Jenna. Thank you, the others, that we tailored a town hall around our staff schedules, 7:30 to 7:30 tonight, around shift changes. We allowed for pre-submitted questions for the town halls for our colleagues to provide that submission. So openly encourage and participate activation in our town halls. We have nursing practice councils here. We have bedside nurses that are part of nursing practice councils that can then really build the nursing practice culture that we want and have the autonomy. We have interdisciplinary shared governance cultures, committees here as well. We have nurse residency programs that provide the opportunity for nurse residents to have open forum with leaders here on what's going well, what do we need to work on. Really key on making sure that open lines of communication are there. And I think that's one of the things that is unique at TMH compared to other places, that my office is located on the ground floor. I'm accessible. All of us are accessible here. We have nurses that come in at all times to say, hey, we have this idea, or hey, this is the opportunity, we could do better. The relationship here and the leaders that are here that have worked at the bedside know the importance of having that participation from the bedside nurses and having that voice, that we really thrive on that, and we make ourselves available as much as we can to make sure our nurses have that voice.
Can you talk a bit more about the nurse residency program? You started in 2008. I don't think it was established quite yet then, but can you talk about the benefit that you see as a leader to the nurse residency program?
Absolutely. The nurse residency program, I started in 2008, and we had a cohort emergency services that we did the E&A modules under nurse residency. So it wasn't the broad nurse residency program that we have today. It was more of a localized in the emergency department. So had some actual real experience of going through what that looked like. Today we've expanded it and it's very broad. It's now service line dependent, where women and children, critical care, emergency services, and medical surgical are cohorted together in the nurse residency program to go over some of the things that are important, code blues and some of the skills. But the real intent and purpose of the nurse residency program is to provide that social support and that availability, that when you start out as a nurse and evidence is out there that you feel very comfortable during orientation, and there's a period that your confidence and your nursing skills will take a dip. Something will happen, and it's a normal course. The intent of that nurse residency program is to provide that social support and those structures around that. We provide that well-being to you all, whether that is coming together as a group and communicating as a group to share your experiences as a group, whether that's providing the access to the leaders. Those things are important. There's a lot of evidence around that. Ours is pretty standard compared to other robust systems that are out there. It's a year long. Great success rates in the nurse residency program. The technical side you have learned through nursing school. The technical side you learn on the job here. We have didactic orientation. We have very prescribed orientation for critical care emergency services. That nurse residency is really to help with the social support of the new nurses that start.
About how long is an orientation typically? That was a question that we had from Holly.
Absolutely. So it's different depending on the area that you go into. So medical surgical, you're looking at a 12-week orientation. Some of that is didactic. Most of that is hands-on with a preceptor. When you then branch over to critical care, you're looking at a 4-month orientation. Emergency services is a 6-month orientation. We use the curriculum that's such as ENA, Emergency Nurses Association curriculum in these areas of specialty. You go into AORNE or AORN, which is in the operating room. It's a 6-month orientation there. Women's and children's a 4 to 6 month, depending on where you go. But it's all tailored to the specialty that the nurse starts in.
Thank you. We have another question. What can I do at TMH with an MHA degree?
With an MHA degree?
MHA. Mm-hmm.
There's a lot of opportunities. So whether that is administration, I'm a firm believer that I have an MHA as well. We have many individuals here that are MHA degrees wanting to launch into leadership. The great part about TMH is you look at the diversity of roles that we have. You do not have to be a clinician. You do not have to be licensed to make an impact here. Where do you start out in your leadership career? Where do you take that MHA and you say, I want to manage this operation, whether it's a practice manager, whether that's a manager over a department such as transportation. What are the operational jobs that we have here that require that MHA, that leadership training, that doesn't require the clinical? We have many. And the TMH.org, if you look at the website, you will see that there are many jobs that don't require a clinical licensure to make a difference. So many individuals, many of our administrative team, many of our executive team have MHA degrees and don't have the clinical background here as well.
And I know that that's a concern of entering the nursing profession and feeling that stress or maybe feeling burned out. There are a lot of opportunities outside of bedside, right? That they don't have to leave the profession entirely. They can maybe transition somewhere else. Could you kind of list maybe some of those?
Absolutely. And that, I'm gonna go back to, some of the best knowledge was from my father, and he was the PA. And, if you look at a traditional physician assistant, it is practicing with a physician and you're taking care of patients directly. In the nursing career, the opportunities are just so diverse and so broad that spend time at the bedside. We have registrars that look at data. We have quality improvements that's analyzing the data. We have leadership tracks and roles. We have advanced practice that if you want to go into the advanced practice sector, if you want to do case management, there are many roles. The big one now is we're transitioning to Epic, which is our EMR, electronic medical record system. We have nurses on the IT side now that provide the support to then take care of clinicians that are now trained on the IT side. That the opportunities for nursing is just nothing that we've seen before, and I think that's part of why you see vacancy rates that they are, because the field is so diverse that there are many opportunities away from the bedside that you could launch your career in as well.
Excellent. And we have another, we have a comment. There are nurses in HR as well. So human
We do.
resources can be an outlet.
Our HR director's a nurse, so we're recruiting. So Renata, calling out to Renata.
Hi, Renata. And then we have another question. How many months is the orientation at the main ED? I think they were looking for clarification on that.
Yeah, so it's typically 4 to 6 months, and it's really tailored to. It is a high complex environment. The acuity is incredible. When you look at the acuity at our main and Bixler, as we talked about, the number of traumas, the strokes, the comprehensive strokes, the advanced cardiac, it is some of the highest acuity you will see in the state. The ER physicians are incredible, but it's really tailored to a 4 to 6 month. So if you have experience in medical surgical and then you launch into emergency services, we're typically looking at 4 months. If you have if you're a new graduate coming into the Bixler, the main, you're looking at 6 months. So that's the window for what a general orientation will look like.
So say someone wants to transfer out of their unit that they started on. About when could they potentially transfer into a new unit?
We look at typically a 6 to 12 month window, and it's really dependent on what area that you start into, and if there's areas that make sense that is a natural progression. So for instance, neurology to step down to critical care, and they're all in a family together, we see quicker paths to, let me start in neurology, let me then move to step down, let me move to then trauma. When you look at that, our policy is the 6 to 12 month mark. We really advocate, though, that when you start as a new graduate, stay somewhere for a year to get that foundation. Really understand what you want, where you're looking at. Make sure you make a wise selection, because as we are investing in you, there's also a piece of the business, just frankly, that we need some of that longevity on the units. That every time you transition, and if go back to the emergency services, for example, you're a new graduate in medical surgical, it takes 3 months to train. You transfer within 6 months. There's a short window, and then we start you on a whole other orientation training program for another 4 months. There's a period that you need to get comfortable in practicing nursing. So as a new grad, I strongly advocate for 12 months to really get that good foundation there, and then get that make sure that decision that you're making to go to the next unit is the right decision. But there are instances that it's before that as well.
And you talked about, becoming and developing those skills on the unit. There are also certification opportunities as well. Can you talk a bit about, I believe it's called Professional Nurse Advancement? Can you talk about that program and the ability of TMH to reimburse?
Absolutely. So that then flows into some of the compensation questions. So when you look at base compensation, it's very challenging as a nurse. So you have a base compensation, then you add certification pay on it, then you add differentials on top of it, then you add education certifications on top of it. Understanding compensation as a nurse is very challenging. Your base rate is just the first starting point, then you add things on top of that. So make sure that you understand that when you venture into getting an offer, what does that really mean? From a certification standpoint, there are certified emergency nurses. There's a certification opportunity that if you go get certified, you get tested. Then there's a differential that comes back to you that's on top of your base comp. If you have a BSN, a bachelor's degree, there's a differential that then goes on top of your base comp. We at TMH really advocate for making sure that our nurses have the opportunity to become BSN, making sure that we offer certification programs. We have HealthStream here where nurses have access to prepping for these certifications, and then providing reimbursement for testing. And then on top of that, once you pass the test, you get a differential as well.
Can you talk about tuition reimbursement?
Mm-hmm. Correct.
Yeah.
So go ahead,
I'm just
Jenna.
like for nursing school. Can you talk about those
No,
opportunities?
tuition, absolutely. So whether you're a somebody that has interest in nursing, pre-nursing, and if you start as a patient care assistant here, we offer programs and have partnerships with TCCs and offer scholarships outside of TCCs where you have the opportunity to grow, not just in nursing and radiology and other disciplines as well, where we'll provide some tuition reimbursement back to you all. Our normal partnership is with TCC, and we have a good relationship with them to provide that training as well. But we offer that pre-launch into that clinical profession, nursing, radiology, respiratory. And then if you go to an ADN program, have an associate's degree, we offer tuition reimbursement as well for you to obtain your bachelor's degree. We have a program with TCC that is a work-life balance program that's mostly online, that we provide support to our nurses to get their bachelor's degree, and they can continue to work at the same time as well.
Awesome. Where are some areas right now that new grads have a sign-on bonus opportunity?
So I'm going to go back to when you look at our vacancy rate, and this is not what you see across the nation. We're very fortunate that our vacancies in critical care, emergency services, women and children is very low. They're when you compare it across the state, they're unheard of, which is very positive from our standpoint. When you look at where our opportunities are need that are currently, it's mainly medical surgical. Our medical surgical units and our step down units, cardiac progressive care unit, which is a step down unit, have those sign on bonuses for new grads linked there. And our goal is to, once again, provide that foundation for you all to start your career there and then launch into that next area. But currently, our sign on bonuses are tied to medical surgical.
Brittany's asking, does TMH offer tuition reimbursement for an RN, BSN, or to pursue an MSN?
The advanced degree currently we don't. That's something that we talked about and we're looking at, and looking at the benefits. Right now it's ADN to BSNs, it's certification reimbursement. There is value in advanced degrees, and that's something that we talked about as a leadership team that we need to go back and look at going forward. What is the value? What is the areas that we need to? Is it leadership? Is it education? Are there other areas? That's something on our radar, but at this time we don't.
The door is open, it sounds like.
Yes.
So for Cheyenne, Cheyenne's saying, "Hi Ryan, thank you so much for hosting this meeting and for all you do for the community. This Q&A is a great open forum and opportunity to inform the community about the tremendous opportunities for nurses in our community. Ryan, what guidance or insight can you offer for nursing students who are attending clinicals at your facility? Can you speak about some of the feedback that you've received from staff regarding the student clinical experience and what they would like to see more of in the students?"
Yeah. I'm going to answer that in two parts. We are very well aware here in our leadership team that we want the feedback from the faculty, we want the feedback from the students. We want to make sure that this is a place that you feel like you're getting the training that you need, and we're treating you with the respect and the kindness. We do a survey on an annual basis that gets sent out to faculty, that gets sent to students for them grading us on your clinical experience that's here. And things that we can improve upon. And a couple of examples of that was access to computers. Well, we have now, a room down here that has mobile computers that we want to make sure that the faculty has access to computers. We have a room down here for debriefings down on our administration hallway, and that's strategically placed there because we want to have relationships with you all. We want to get to know you as you're doing your clinicals here. That is that important to us, that we know that you're the future of our workforce. We want to be here to answer any questions, whether it's related to TMH, not related to TMH. We want that relationship with you. So through that survey, we made changes here. From a student perspective, learn as much as you can. I know it's intimidating to go to a floor and you see all the chaos that's going on, the busyness that's going on. We really take it serious, and we want our nurses to be an active participant and helping, be a bridge to students and really mentor them. So when you're upstairs, learn as much as you can. ask if you want to go see an OR procedure, if you want to go see something in cardiology and some of the advanced stuff that you don't typically get exposure to as a nursing student. Ask. It's okay to ask questions. It's okay to be involved. We want that. We cherish that. And that'd be my advice to you as a student. Cherish the time that you're here. See as much as you can, and ask a ton of questions.
I love that. So this is a question that is frequently asked. What should I wear to my interview? Scrubs or business attire?
It's a mix. I would tell you that if you're starting your career, and part of your curriculum in nursing is making sure you have a resume in hand, making sure that you get interview prepped. Start with the business attire would be my recommendation. We see experienced nurses that come that arrive in their scrubs and they have jobs. I don't think there's a right or wrong answer to this. My recommendation personally would be, the school provided those resources and that prep for a reason. Here's how you do a resume. Here's how you do interview questions. There's guidance around business attire. My recommendation would be the business attire, but I don't think there's a right or wrong answer to that.
All right. Dress for the job you want, scrubs. So someone also asked us, how late is too late to enter nursing school? This is a second career opportunity.
I would speak to, we have several individuals here that are second career that, 40s, 50s, that they went into nursing school and, with education backgrounds, with other business backgrounds. There's not a time that is too late. Now, I'll tell you the physical demand of nursing is increased. The workload associated with nursing in the acute care hospital is higher than we've seen. If you look at just the natural progression of healthcare, we're taking care of a greater aging population. The acuity of hospitals today are a lot larger than or higher than they were in the past. Most of the patients in the past that were in the hospital are now home with home health and outpatient surgeries and all that. So the acuity here is high. The demand and the physical work is high. But if you have that drive and you have that passion, there's not an age limit to enter that profession. We've seen successful individuals in their 40s and their 50s that go back to start nursing school as a second career and done great work.
On a similar note, we have someone who's looking to relocate to Tallahassee, is kind of in the final phase of their career. Are there positions that you feel are best for people who are kind of looking to settle down, slow down in their nursing career?
Absolutely. We see a traditional migration to, if the best thing that we can do is reinvest in our new nurses here. So if you have a plethora of knowledge and experience at the bedside that you want to then pay back to the new nurses here, educator positions, reinvesting in that where you're now providing that didactic and that structure to nurses on the floor to provide them the training that they need. Educator positions are awesome. We have a lot of tenured educators here that decide to go that route, and as a win-win for both parties. Case management is another big piece of that, helping the families with discharge planning and moving out of the hospital, providing that nursing expertise and assessment that is needed. Those are other traditional roles that we see slow down, but there is plenty of opportunities at TMH and in healthcare to taper down and then provide value back as well.
All right. We have one question that's coming in from Stokes, it looks like. This is in regards to salary. What is the starting salary for nurses at TMH? I know that this is subject to change, and then also subject to the person.
Yep, absolutely. That's one of the things, and I'm an honest, transparent person to a fault. One of our opportunities is becoming more competitive in the market with salaries. Right now, we're at the $25.50 to start. It does not include any prior experience or any of the add-ons I talked about, such as differential certifications or any of those things. We know that we need to become more competitive. We're actively looking at, hopeful that we have some changes within a very short period of time. So we're working on that. That change that we're looking at will get us more competitive to what our region is. But one thing I do want to mention about salaries in my soapbox is when you talk about not-for-profit and for-profit, we heavily believe that part of the salary and start is providing the resources and support that you need in patient ratios, ancillary support staff, that when you look at the revenue that comes into TMH, 50% of that revenue is then sent to salaries and wages. That is a large number. When you look at for-profits and other places, that is a lot smaller percentage, where there may be a $1 or $2 difference in base pay. The amount of nurse to patient ratios that are there, the amount of ancillary support, transportation, patient care assistance, resources that are available are typically a lot slimmer. So when you look at salaries, I ask that we need to be competitive. We have some opportunity there. We're looking at that, but also look at the factors to you of what is your license, what is support that you need, because we invest heavily in making sure that we have adequate resources to take care of our patients upstairs that many other places may or may not look at.
And I imagine that having a lower turnover rate compared to a lot of other hospitals, it alleviates the burdens on the individual nurse, and that must impact kind of a work-life balance as well.
Absolutely. And one of the things is we look at external, my goal, and we were at a period that we were here, we want core colleagues, we want core nurses. What that means is we want nurses that are employed by the hospital, and we want our physicians to be full-time colleagues of local and nurses that want to live in Tallahassee to fill our spots. There's periods and times where if you look at our vacancy rate, even though that is low, we still have to use travelers and contract labor. Our goal is to have a vacancy rate of less than 1%, less than 2%. That is a far-fetched goal, and that's not what most healthcare systems can do or even have the goal to do. That is our goal here. We were at a period that we were there. That being said, we are now using a handful of contract labor, not to the extreme that many other places use. But one of the indicators that we look at is the travelers that we have, they submit a survey back to the institution to say, what is your experience here? How is it compared to other places? And that is a gauge because those individuals have worked at many other institutions. 80% of those travelers that work here at TMH provide feedback that this is the best environment that they've been, this is the safest environment that they've been, and this is support. One of the challenges that we have with new grads, I started my career here, this is what I know. So the challenges that we see, I don't have the experience to see at another institution what their challenges really are. We have the opportunity to talk to those travelers or nurses that come from other institutions. They rave at the opportunities here, the support that we have here is different than other places that they have worked at.
So Marco wrote to us and said, I want to be a nurse, but I don't know what I want to do in nursing. What do you recommend?
You will find it quickly through your nursing curriculum. And once you get enrolled in the nursing program, that nursing curriculum provides exposure to all facets of nursing. So usually those individuals that when I went to nursing school, I didn't have any idea what specialty I wanted to go to. I fell in love with emergency services, and I knew that that's where I wanted to go upon graduation. I did not know that beforehand. So I think there's two parts of the question. First part, or two answers of the question. First answer would be, if you want to be a nurse and you want to make a difference, and I really cannot stress enough that going into nursing is really, you want to serve others, you want to make a difference. There are wonderful things of our job, but there's things that are hard and there's things that are tough, and every day is not a good day. But the passion goes back to, I can make a difference, I can serve others. I made an impact in somebody's life. That is the drive of a nurse. Start nursing school, you'll get exposure to different areas. And if you're still after nursing school, don't know where to go, start medical surgical, because then you'll really find out what niche you want to go to after that. Or you may just say, I'm in love with medical surgical nursing and I want to stay my career here. But there are many opportunities to explore that as you go forward.
We have another question. This one's coming from a Jenna Pope-Martinez. I have a question. How do you handle all of the questions from family members, from friends, from people on the street who hear that you're in nursing and then want you to diagnose their illnesses, their cuts, their scrapes, their bruises?
I am transparent, honest to a fault, where I am a nurse. It's been 2008 since I practiced. I have a still assessment skills. I still say the best as I can with evidence-based practice, but I'm also honest enough with myself to say I'm not the most up-to-date progressive person in the healthcare field. If it's something I feel comfortable with, I'll answer that. You being a nurse, you're constantly serving, so that just comes natural. But the great thing about healthcare is you build your friendships and your families around other healthcare clinicians, and that's normal. Where if I don't feel comfortable, I can link them with an expert over here that has that knowledge and that expertise. And to me, it's an honor to hear those questions. But you have to be honest with yourself at times and go, I'm a little bit outside of my knowledge base. I need to punt that to somewhere else.
Thank you for answering that. I appreciate
Absolutely.
it. I always feel like I'm bugging my siblings are in healthcare, and I always feel like I'm bugging them.
Keep on asking.
Um, yeah, I'll get my answer eventually. So you talked about kind of the family nature of TMH. Do you think that that comes from the community-based structure, from the nonprofit structure? How do you view that differently than, the experience, does it impact the daily experience that you feel that as a nurse?
100%. Without a question. I've been exposed to have opportunities in other corporate systems, had the opportunities to branch out and leave TMH. I'm here, and there's reasons that I'm here. That community presence is, I cannot speak the importance of that. Having a local board of governors, I cannot speak the importance of that. These are individuals that are in our community that is helping shape what healthcare looks in our community. When you look at the leadership tracks of those individuals that started as new graduates here, um, that's powerful. What you see in most other corporate entities and institutions are when you get that experience and that expertise, you get launched to the next institution that is a larger, bigger, because they want that scaling of leadership there. But you start losing the touch of the community and the presence of the relationships on the floor where, leadership transition in other institutions is a lot greater than what it is at TMH.
We have a question from Brittany. Responding, thank you for providing the information in regards to salary. Are there annual or quarterly reviews that allow the nurses the opportunity to increase their compensation as a new nurse at TMH?
So there's annual reviews, and we do a traditional merit base cost of living 3%, which is pretty standard. There are institutions that do not do that, but that's one of the opportunities. When you look at the other, I talked about the BSN certification, which is another opportunity. You look at just certification in your area of specialty, which is another opportunity. We have programs that are built as well where if you go to float pool, it's not based off of years experience. You just have a minimal qualification. You have a higher fixed salary. So there's opportunities to launch as well into a higher fixed rate. Weekend plans are another. One of the things that we're exploring and very optimistic about, and kudos to Monica and our HR team, is doing performance-based compensation. So we know that we have high performers, we know that we have middle performers, and we want to compensate the high performers and provide that recognition to them. So we're exploring that here at TMH. We're looking to launch that within the next 2 years, which seemed like a long time, but when you look at the complexities of the systems that it takes to do that with 5,500 colleagues, we need to make sure that we do it correctly. But that is one of our incentives that we're looking at as well in the future.
Excellent. We are at the kind of 10-minute mark, so if you have any last questions, feel free to send them in. And we have one question that says, I like surgery in the trauma area of healthcare. Where should I start as a nurse?
There's two parts of that. I think we've made a lot of progress in the last couple of years of starting new graduates in OR, which traditionally wasn't seen in the past. There's trauma OR and trauma are completely different. The trauma side in emergency services, you're stabilizing that trauma patient, you're assessing that trauma patient, you're making sure they're hemodynamically stable, and then you're transitioning. The OR is you're doing the repair. And you're in a sterile field, you're doing the operations. But the difference between what a nurse does in the trauma center versus what a nurse does in the trauma OR are completely different. So I want to go back to look at what is it that you really have the interest in, and do you shadow both to understand that? But once again, if that is your passion and that is your drive, or if you want to learn more, do you start on a post-surgical unit, such as an orthopedic trauma medical surgical unit, such as a post-operative care unit? You understand what the outcomes of the surgeries are, and then you launch back into, do I want to do the pre-side, which is the emergency center, or do I want to do the surgical side, which is the OR, or do I want to just start one of those areas after I do the shadowing experience?
Excellent. We have a couple of questions here that are gimmies. What's been your most rewarding experience in nursing at TMH?
Um, what keeps me, these jobs are high stress. And healthcare in general is a high stress area. There's ever changing, you have COVID, you have things that you can't predict, that changes your world drastically. most rewarding, it's the little things that you do each day that you can see you make a difference in the patients and the families. It's just those little bits of information, and whether that's a letter, whether that's a phone call, whether that's watching somebody that we didn't think would progress into heal, and walk again, whatever that may be. Those are the things that keep us re-energized and keep me re-energized to continue to do what I do.
And you talked about the letters. I think this also would be pertaining to kind of Brittany's question. There are opportunities, eye care awards, Daisy
Oh, yeah.
Awards, to that. Some of them have a financial compensation attached to it. Can you speak a little bit more about those?
Yeah, absolutely. So we have, just as Jen said, we have eye care awards, we have Daisy Awards. They have, a small monetary token with it, but it's recognition as well. Our goal is to promote our staff here, recognize them, whether that's through compensation or recognition or professional advancement is the other big piece of it. We have a leadership, TMH leadership training curriculum that's just started that are high level performers. There's nursing in that as well. That really is advancing individuals to go into the leadership track that they want to go into. So there are multiple opportunities here, through some of the recognition programs to earn more monetary, as well as a career path and development.
Another frequently asked question that we get is the cafeteria food good?
It actually is. I started in 2008, and I would tell you it has grown significantly in 2008. It's not the typical lunchroom cafeteria food that you see at a school. We have sushi that's made each day. We have sandwich trays and lines. We have hot grill. We have soup. It is remarkably good. So if you haven't tried it, come try it. And when you do your shadowing experience, or you come in to say hello, stop by the cafeteria. I think you'll enjoy it more than what you think.
All right, Ryan, do you have any last minute career advice? Anything that you want to emphasize?
If you want to get in healthcare, and if you're a pre-nursing student, unless you have a drive to go to physician assistant, med school, whatever it may be, nursing is a great career, and I cannot express that enough. It provides you the opportunities to launch, as we talked about today, to many, many other avenues, that you want to go. So nursing has been a great career for me. Through leadership and executive leadership, I'm not naive to understand that my position today and where I'm at in the organization, in large part, has to do with my clinical background, and I have that opportunity because of my nursing degree. Not saying that you don't have that opportunity with the MHA or whatever it may be, but having that clinical background definitely provides that, infrastructure and that visibility that have been rewarding to me. So that is number one. If you want to get in healthcare, you want to make a difference, go into healthcare for the right reason. Go into healthcare because you want to serve. And I can't express that enough. You want to serve, you want to make a difference. There will be days that are tiring, there will be days that are tough, but it is immensely rewarding to do that. Nursing school, selecting your first employers is huge. Take time to do that. Take time to really understand what you're looking for. Don't get caught up in just things such as compensation. Look at support, look at the culture, look at the other things. I'm not saying that because we may be lagging in compensation. I will tell everybody that, whether they're staying locally or not, that first selection in your nursing career is important. That's going to be your fundamental training. Make sure that institution provides that resources, the support, the infrastructure that you need, and whether that's to stay as a bedside nurse, whether that's to go to advanced practice. Make a well thought out decision, and make sure you shadow and make sure you understand the leadership that you're working under before taking a position.
Excellent. If anyone wants to speak with you more in depth, are they able to contact you?
Yeah, absolutely. You can share my email. It's very simple, ryan.smith@tmh.org. Feel free to send me an email. If you're at TMH and you're upstairs doing shadow experiences, if you know TMH, there's the cafeteria that we talked about. There's the gift shop. Nursing administration's right on that middle between the two. Stop by, say hello. Be happy to speak with you. Have our team speak with you here. We have a great, robust leadership team here on the hallway. We're always open to help and assist in any way we can.
And our HR team is very responsive as well. If they don't know the answer, they'll get you the answer too. Feel
Yeah.
free as well to follow us on all of our social media streams. If you have any more questions, we'll make sure that the person that it's kind of related to or pertains to gets that and gets you a response. Ryan, I want to thank you for all of your valuable insights. I really appreciate you taking the time out of a very busy day today. And I want to thank everyone for joining us as well, for asking questions, for being engaged and supportive. And I hope that the information that we've discussed proves useful to you in your early and burgeoning nursing careers. And I hope that you feel a little bit more clear, a little bit more confident than you did before. Please don't forget to take a look at all of the career opportunities that we have at TMH that are available for nursing and also pre-nursing. You can find those at tmh.org/nursing. That's tmh.org/nursing. And have a great day, everyone. Appreciate it.